Hello everyone, I'm Dr. Danzo from Department of Psychiatry in Number 1 Defense Services General Hospital. Today I'd like to point out some stress and then the problem related with stress and how to improve our ability to cope with stress. So in these days in our country, it is quite catastrophizing, or most of the people in our country will face a lot of difficulties and in a every in a variety of forms of conditions like financial and economic and educational and other so and so problems. So in these days, we might have more chance to face the problems, and then we might suffer from more kind of medical problems related to stress. So before we go thoroughly to the management or coping skills of stress, we should have knowledge about what is stress. So, stress is actually an external or internal event that provoke your intense sensations in your mind and in your body, both in medical terms, both physiologically and psychologically. So this affects your body and your mind. So the stress is three kind of stress. So the first one is normal stress that we have to face in our daily activity. We have to do our works. We have to go to our work for any money, and we have to face some problems in our family, social, occupational, and our environmental conditions. And for example, for a student who have to try hard to pass the examinations is kind of normal stress. And and again, when the stress is quite higher, but the particular person can still have a coping, is called a tolerable stress. The stress is more intense than his normal daily activity in the special occasion and the special events like accident and a crime or another losing of something or another unusual social circumstances will be the tolerable stress. But in this condition, the particular person will have to do something to overcome that kind of problem. And the third one is the toxic stress. When the tolerable stress takes for a long time to finish or to end, or when the intensity of a particular problem is quite beyond the ability for a particular person to cope, it becomes a toxic stress. It affects this psychological condition, it affects the normal mental behavior, and it affects the bodily sensations, and so it makes the person heart bound quickly and rapidly, and it makes them with the cool and clammy extremities, with the profuse sweating and like feeling intense, feeling nervous, or so and so physical inconveniences. So when it is prolonged, it makes the person medical condition worsen. So this is something related with the stress. So when the stress is quite prolonged, for example, we people or and living organisms have and primitively the ability to face the challenges in life. So the ability to become stressful events may help the particular individual to promote his ability in his life. Uh, but stress is when as I've mentioned earlier, when stress is quite prolonged, so the sequences in the brain to adapt the particular stress conditions may be prolonged, and it does not become to a normal state. It's called prolonged allostatic reaction. So it makes a lot of sequences in medical conditions like your stress hormones in your brain may be increased, and the other hormonal and neurological and other physiological responses may be quite increased for a long time that make your vital organs to be exhausted, and finally they have some kind of medical issues or problems. So in psychiatry, most of the psychiatric problem may related with stress, because whatever the clinical syndrome is, the patient may suffer from a lot of disturbances and a lot of problems in the life, so it causes a particular person stressed. And especially in stress problems and psychiatric stress disorders, may have acute stress reaction. The patients may suffer from catastrophizing physical or mental conditions, responding or reacting to the particular stress event. Or so quite common is PTSD, post-trauma distress disorder, and when a particular person may suffer from the quite a big event like a disaster, or being kidnapped, or being tortured, or being or witnessing something challenging or scary event. He may have intense mental feeling and a mental suffering in his brain, and it caused him being cannot be escaped from that stressful or panic condition for a long time. This is called the post-traumatic distress disorders, and it's also characterized by 3 or 4 conditions like re-experiencing. And it's the patient, even though the stressor is diminished, the patient may suffer from the same feeling and emotions and physical responses. Likewise, he is experiencing that stressful events at the current time. This is called re-experiencing. And the second one is avoidance. The patient may avoid all the conditions which is thought to be the same event that he has experienced in, and that trauma is psychological trauma, this kind of avoidance. And the patient may have does not calm down, always feeling hypervigilance and hyperarousal. It's called and a hypervigilance. This is also always in the readiness to respond to an unexpected event. So he is not in the restful condition all the time. And the next one is the negative alterations of emotion and cognition. Or the patient may thought all the negative thinking and emotions about the self and environment and the future, because he is being traumatized in his mind. So it is called PTSD. And the other thing is panic attacks. The patients may respond with the unexpected and acute conditions of breathlessness and feelings of losing of something, feelings of uncontrolled and out of blue. So it is quite disturbing. Even though the patient is in the normal conditions, for example, while he's in his work and or speaking with some other people, he suddenly suffered from that kind of attack. So it is quite dangerous, and it's quite disturbing, and both physiologically and mentally. It may have other consequences like accidents and trauma or injuries to oneself and others. So in these all kinds of stress, when it is quite severe and it becomes medically challenged, we have to prescribe some appropriate medications related to its particular problem. And it's also important to do some psychological changes related to his mood and in the stressful conditions. So in the non-pharmacological approaches, they are very important, like cognitive restructuring. So the patient may have negative cognitive biases about its stressful conditions, about its current conditions. So we have to manage, we have to help patients cope with that ideations and thinking to the right way, and an effective or a positive kind of thinking and the effective style of behavior. So it's one sort of important non-pharmacological approaches. The other thing is relaxation techniques, like in the progressive muscle relaxation techniques. The person with the such as panic attack or very stressfully reacted patients, we have to help the patients to analyze or to evaluate what sort of worriness do he or she has. So, and depending on that condition, he has to analyze the real condition, and this is not that severe and not that dangerous as he might thought before, and focusing on his present situation and present body and mind, and relaxes all the muscle or the joints, and focusing his mind on his body, like his his or each and every groups of muscle, and tense for 10 seconds and then relax for 10 seconds, and the mind he put his mind only on the body and a different muscle group again and again. So it makes the person not focusing on the stressful events, and it changes way of thinking on its own conditions, like meditation. It's helped the patient reduce the stress reactions. The another one is desensitization. So especially the patient with panic attacks, so the people may think that the condition they fear is quite severe and it's quite catastrophizing and it's quite dangerous for them. So we help the patient evaluate and reduces thinking that he already put his mind. For example, the person with fear of spiders, it helps the person to see, to think about the spider first, and to see the picture of the spiders again, and then in the next level to see the real live spiders, but it is protected in the box, in a plain mirror box or something like that, and again the patient is asked to touch the spiders or to let the spider crawl on his hands or something like that. Finally, he realized that the spider, what he was quite scared, is not that scary as he thought before. This is called some kinds of desensitization. Another way of mental change through stressful events is like fear conditioning, so to recondition our mind. So, for example, when a patient with quite traumatized in his mind in a car accident, something like that, at that event he heard a voice of a loud car horn or a loud voice of car engine or something like that. So in the next time, whenever he hears a sound of horn or engine, he may feel the same stress reactions as the previous event. So it is called fear conditioning. So we have to reduce the fear